start off with this picture. This is a yoga instructor named Tao Porchan Lynch. She's passed away, I think, in 2022, but when this photo was taken was 101 years old. And so you can see she's actually kind of hovering a couple inches off the floor, using her upper body strength. And so I think when we think about healthy aging, this is often the type of image or picture that comes to mind. But, as a geriatrician, I also see this as being healthy aging. This is a person who obviously has some mobility limitations. She's in a wheelchair. She's getting support from a caregiver, it looks like. But she's out there, she's engaged in a social event. She's outside. She's able to access resources like a wheelchair and having a caregiver. So this can also represent healthy aging. And so just to say, this is a definition that doesn't mean you look one way or another. It just means that you're able to optimize all the different aspects of your health as much as you can. And so this is just a model that we like to think about in geriatrics, where we think about, how do we really optimize people's physical health, their cognitive health, their mental health? How do we get them socially engaged, which is a lot of what you guys are doing with Hively. And then today we'll focus a little bit on this aspect, which is more healthcare related, but how do we, engage in preventive care and manage chronic conditions to support healthy aging? So just a word about accessing healthcare, and this is something you might have had some experience with in the last few years. So primary care is struggling, to say the least. And primary care is generally provided by people who are trained in family medicine or internal medicine. So you can go on to do a geriatric medicine fellowship, which is what I did. And so you can also see a geriatrician for primary care, although there are, significant shortages of geriatricians on top of primary care shortages. So I like to usually just tell patients, once you have a PCP, try to keep them for a little while, try to stick it out for a few visits, see if you connect with them. Right now, depending on where you live in the country, the wait list can be months long or even longer for primary care doctors. So I usually just recommend that once you have someone, try to stick with them for a little while. And again, primary care is often provided by doctors, so MDs or DO degrees, but you can also have really great PCPs who are physician's assistants, which are called PAs, nurse practitioners, NPs. In a lot of states, these providers can actually act as independent PCPs, but in some states, you will see that doctors alternate visits with PAs or NPs, and that's a pretty standard model these days. I always like to tell patients, write down your questions before your visit, and that way you can make sure in the short time that you have that you can try to get to everything, or at least set up a plan to go over it at your follow-up visit. I always like to tell people, bring in all of your medications. So we actually have people do what's called a brown bag medication review, where they put it all in like a shopping bag or a brown bag and just bring it to the clinic, because that's usually the most accurate way to get a sense of what people are taking. And then a lot of older people, I think they feel like they're not being heard at the doctor or in healthcare settings, which is a real thing that's happening. And so if you want, you can bring a family member or a friend with you, and that can help improve the communication with your healthcare team. And then also just to say, there are these concierge healthcare practices which offer kind of a higher touch and better access. And so these typically are practices that take insurance to some degree, but they also typically have an annual membership fee. So that is an option for some people, and especially in certain geographic regions of the country. So just some general tips. I'm happy to talk more about that as we go. So thinking about preventive care for older adults, so something that a lot of people, I think, underutilize is the Medicare Annual Wellness Visit. And so the Medicare actually didn't really cover preventive healthcare services till about 1980. So they started covering pneumococcal vaccination around that time. And then we had the first sort of initial, preventive annual exams covered in 2005. And then we have the Medicare Annual Wellness Visit today, which was really introduced in 2011. And so these are visits that are very comprehensive. If you've done one before, usually have to fill out a long questionnaire. There's a bunch of different screening measures that the medical assistant or the nurse at the clinic usually does. And so some people, don't see the need for them and they'll kind of skip over them, but they do offer the opportunity to cover a lot of ground at once. So I usually like to say, if you're not taking advantage of getting your annual wellness visit, it is a good thing to do. This is just a table that sort of goes over what all is included in the visit. And so there's some sort of features of a standard medical visit, like a medical history, a medication review, et cetera, blood pressure check. But they also include a lot of screenings about psychosocial health and substance use, health behaviors. So what people are doing for physical activity or nutrition. They will screen for hearing and vision loss, which is really important, as we'll talk about later. There are some function and mobility screens. So some of you may have done the timed up and go test. There's a cognitive test, so the clock draw, and then typically there's some focus on preventive screenings and advanced care planning. And I'm going to just highlight a couple of these today, but just to say, if you haven't gotten one of these in a few years, it's not a bad idea to just schedule one with your doctor, sometime in the future, because it really just goes over so much of the healthy aging preventive care all at once. So I picked a couple things just to highlight from this list, and we can always talk about other elements if people are interested. So the first is colorectal cancer screening. So I just bring this up because there have been some changes in the guidelines recently, and there's some more options for different types of tests these days. So colon cancer typically develops in mid to late life. A lot of colon cancers are not detected. They tend to be asymptomatic a long time before if you didn't have a screening test, you wouldn't notice them until they were quite advanced. So that's because the colon is pretty large in diameter. And so if you get a small polyp that then grows bigger and bigger, it takes a long time before you would ever notice any symptoms in your body. So that's why we do these screening tests to try to pick up these polyps early so that they can be removed before they turn into cancers. And so the main way that doctors do this is by detecting whether or not there are tests to see whether or not there's blood coming into the stool, or you can actually do a colonoscopy where you visualize the colon and look to see if there's polyps or other issues on the colon itself. So those are your two options. The colonoscopy is, many of you have probably done this before. They're invasive. They're every 10 years, typically. Sometimes they're more often if you have certain conditions. And they usually recommend stopping screening at age 75. The at-home stool testing is typically done with something called a FIT test or a Cologuard test, and those are done yearly. So those pick up to see if there's any blood in the stool, and if those are positive, then people still usually need to go have a colonoscopy. And so there are different pros and cons to each approach. Some of the risks of colonoscopy that become more common as you get older and older are things like bleeding after the procedure. There's a risk of bowel perforation, which means like accidentally poking a hole in the bowel. And there are others. And so as people get older and they have a more complicated medical history, sometimes your doctor might talk to you to see if the risks are something that you would like to stick with, or if you want to do something more like the stool testing. So these are just a couple kind of brief primers on options for testing. And I think one thing I usually talk to patients about as well is the guidelines that are out there are for the general population. And so if you are an exceptionally healthy 75-year-old and you might have longer, your life expectancy might be 20 years, then you might still think about doing cancer screenings, understanding that maybe we move away from doing a colonoscopy and we might move towards stool testing as we get older. So there's, this is something that you can talk to your doctor about. And there's definitely people who are in their late 60s and have, another type of cancer and might have a shorter life expectancy. Sometimes that's also something we need to think about. And like, do we really need to be doing colorectal cancer screening? But this is just, one of the recent updates was that the age of colorectal cancer screening was reduced to 45. And so younger people are getting colon cancer more often, probably due to different dietary and lifestyle habits in America. So it's something that we're seeing more commonly in people as they get older. So just something to think about. Another update I wanted to just touch on about preventive care is the RSV vaccine, which you may have already heard about. So RSV is a virus that usually causes a cold-like illness, but it can be much more severe in both younger children and older adults. And so we have 3 vaccines that have been approved for adults who are age 60 and older. Usually I try to use the generic names. In this case, I'll probably use the brand names because the generics are just these acronyms. So there's Arexvy by GSV, there's Abrysvo by Pfizer, and then there's a brand new one that's an mRNA vaccine by Moderna. And these are kind of interesting. So for most vaccinations, the USPSTF, which is the organization that provides a lot of screening recommendations, usually for vaccines, they recommend either a yes or a no. So like the flu vaccine is recommended for everybody. So for this one, they actually recommend a shared decision-making discussion, which is kind of a unique recommendation. And so it looks like for the RSV vaccine, it can help prevent pneumonia, especially when people are much older and also in people who are more frail. So if you are somebody who is older and has a chronic lung disease or chronic heart disease, or has lots of different medical conditions and is quite frail, it's probably a good idea to get the vaccine. I think it's also important to think about, who are you going to be around? Are you around grandchildren who, are especially infants under 12 months where they're very susceptible to RSV? And so it's not something that is recommended across the board for everybody, but there is sort of this recommendation for a discussion with your doctor. So that's something I recommend bringing up, next time you're in the office for your visits. And then thinking about, the substance use screening as part of the Medicare Annual Wellness Visit. One of the things that we've seen a lot in recent years is increased alcohol use, really in adults of all ages, but especially older adults. And we are seeing this a lot as binge drinking, interestingly. I think there's been, kind of the classic, thought about dangerous alcohol use as someone who's drinking liquor, maybe having, multiple drinks per day, or binge drinking a lot. But, with the rise of things like craft breweries, and other things, we see alcohol, like dangerous or risky alcohol use, come up in a lot of different forms. So it's something I usually like to highlight. Older people are more sensitive to alcohol because of changes in liver metabolism as we get older. In addition, people tend to have more medical conditions that can make drinking a little bit more dangerous. So if you have diabetes and you consume a lot of alcohol and maybe you don't eat or you forget to take your medication, there's a risk for things like low blood sugar. So it's something that where the medical condition can interact with the alcohol use. And then typically people are also on more medications that can interact with alcohol. We've heard a lot about how alcohol might be protective against heart disease at moderate levels, but we know that at any dose, it increases risk for cancer and also dementia. So it's something I think a lot of people have heard that moderate use is healthy, and it might be that the case for the heart, but the other parts of the body, like our brain, are very vulnerable to the effects of alcohol. And so the guidelines suggest less than or equal to 1 drink per day for women and 2 drinks a day for men. And some guidelines, like in Britain, they recommend 1 drink a day or less for all older people, regardless of their sex. So just something to think about. A lot of the patients I see in my clinic, have been having 2 drinks a day, with dinner for many, many years. And so it's something, as you get older, you might want to think about cutting back a little bit. Similarly, so thinking about sort of dementia prevention and brain health is hearing loss. And so the term presbycusis means age-related hearing loss. This is the most common form of hearing loss and affects about 2/3 of people who are 70 and older. And we know that hearing loss increases risk for dementia. So it actually, there's multiple hypotheses, but one of them is that there's reduced sensory input into the brain. And so those areas of the brain actually can shrink or atrophy and are associated with memory loss and Alzheimer's dementia. So there are some other theories that the dementia process itself is also causing hearing loss, but there was actually a recent clinical trial where they gave people hearing aids and had them use them for several years, and it did slow the risk of cognitive decline in people who are at higher risk for dementia. And so I usually like to point out, this is one of the few things you can actually probably control about your dementia risk. And it is also really helpful at reducing depression, reducing social isolation, and just improving, family communication and the atmosphere of being together as a family or with a group of friends. So if the hearing screening is included in that Medicare Annual Wellness Visit. And if you or someone else in your family has concerns about your hearing, definitely take it seriously. And, you can always ask for an audiology evaluation. Hearing aids are expensive. They're not typically covered by insurance, but there are lots of over-the-counter options these days. So places like Costco have hearing aids that are, run a few $100s rather than several $1,000s. So there's a lot of different options these days for correcting hearing loss, which is great. And thinking about cognitive screening in general, so this is done at the Medicare Annual Wellness Visit with the clock draw, which you may be familiar with. A lot of people, come in and tell me that they hate drawing the clock every year, but it is somewhat helpful, cognitive screen and way to sort of keep an eye on your brain health to some extent. So if the clock draw is abnormal or you or your family have concerns about memory, that should prompt further testing. So often, PCPs can do that testing. You can also ask for a specialist referral at this point. So typically we would recommend like a geriatrician or a cognitive behavioral neurologist, depending on where you live. But that's something you do have an option to ask about if you do have some concerns. And I think even if you have a normal clock draw at the annual wellness visit, it's a great reminder just to double down on brain health. And so usually I like to talk about a couple different things when this comes up, and I'm just going to show a couple pictures. So this is a diagram that looks at different dementia risk factors that you can actually modify in each phase of life. So in early life, it looks like people who have lower education levels actually have a higher dementia risk. Often when we're older and we're coming into the doctor, there's there's not a lot we can do about that, but it's just something, if you have children or grandchildren, this is something really important to focus on, is just trying to increase education. In midlife, hearing loss, and I would say mid to late life, hearing loss is a big factor, as we just talked about, and also blood pressure control. So getting blood pressure closer to 120/80 is really important. And that, not only to reduce heart attacks and strokes, but also to protect the brain and all the little tiny blood vessels in the brain from damage. Treating obesity and trying to work on healthy lifestyle is also really important and can help reduce risk for dementia. And then in late life, there's a lot of stuff you can do around lifestyle. So things like reducing or quitting smoking, treating depression if you have depression, being physically active. In particular, for physical activity, it looks like resistance training, which is things like weightlifting or using resistance bands or even body weight is really helpful, especially for the legs. So things like squats, lunges, Tai Chi, anything where you're kind of bearing weight on the legs and keeping your mobility intact is really important. Aerobic exercise too can be very protective. And then reducing social isolation. So a lot of people ask about brain games like Sudoku or crossword puzzles, but really socializing with other people is going to give you a lot more cognitive stimulation than anything else. So that is one of the top things you can do to try to protect your brain. And then managing diabetes and keeping blood sugar in check is also a really good thing to do for your brain. So there are lots of other things that go into brain health. So reducing alcohol, as we already talked about, making sure sleep is restorative and there are no sleep disorders, and then managing stress. So a lot of stuff you can do. Another thing that we also like to think about as geriatricians are medications that can actually slow thinking. So this is just a short list, but things like benzodiazepines, so Ativan, this is a medication that cannot be suddenly stopped. So you do have to work with your doctor to come up with a plan if you are interested in trying to reduce your dose or stop this medicine. But these can definitely slow down. They kind of almost act like alcohol in a way where they kind of just slow everything down. And so we know there's been some linkage in some studies to future risk for dementia. So these are definitely, a priority to target. And then things like zolpidem or Ambien, Benadryl, and then so over-the-counter medications that have the word PM on them, they usually have something like Benadryl in them that can really, slow the brain. They can increase risk for falls, increase constipation. So they have what's called an anticholinergic effect. NyQuil, similar idea. And then medicines like meclizine or Flexeril as well. So, and then opiates as well can slow thinking. So just a kind of a short list of some common ones that we come across. Just keeping an eye on the time here. So I'm going to skip that slide. And then we briefly mentioned this already with the cognitive sort of brain health section, but thinking about a lot of my patients tell me that they walk for exercise, which is really wonderful. And that's a great aerobic activity for most people. It is also really important to do some sort of muscle strengthening exercise on ideally 2 or more days a week, and then also some activities to improve balance. Sometimes you can hit multiple areas with one type of exercise. So something like Tai Chi or yoga is a great example of that. So, but I usually like to, for the difference between the guidelines for older people is that really this balance component, and really trying to, our balance systems will naturally decline as we get older, but we try to, slow that down as much as possible and really work on that where we can. And this is a graph I like to show a lot, but if you can start exercising later in life and you can get a lot out of it. So, the blue line is really like someone who's a lifelong exerciser, and the red line is someone who's sedentary. And so even if you start late in life, you can get, definitely some exercise capacity back. And you can try to slow down the loss of muscle mass and balance as you get older. And hopefully that'll help, keep you independent longer, and also help with lots of other things like brain health and sleep and mood. So it's always worth working on. Okay, so I think because I am running a little bit long here, I'm probably just going to pause for the discussion, and I'm happy to go back to any sections if people had thoughts or questions.